Okay. Um, Good afternoon, everyone. We're going to go ahead and get started with our presentation here in the Exchange Center. I'll just start by introducing myself. My name is Allison Slayton. I work for Cognizant. I work on our portfolio strategy team, mainly in payer strategy, specifically with FHIR and DaVinci and our EPA solution.
Hello, my name's Rob Burrell, and I'm with Infor Cloverleaf, and I'm a product director and have responsibilities for our FHIR-based products that are focused on prior authorization.
My name is Janie Miller, and I'm also with Cognizant TriZetto. I work on our shared solutions team. I'm a solution owner with our TriZetto Unify strategy. So that's our strategy of bridging payers and providers together with these FHIR-based transactions.
Perfect. All right. We will go ahead and get started.
All right, I'll take it away. So, welcome. As you haven't figured out already, this is a joint presentation between Cognizant TriZetto and Infor Cloverleaf and transforming healthcare end-to-end data conversations. Go next slide. We'll kick things off by talking about prior authorization and its importance and how it can make things more efficient. So we'll talk about the transformation that's going to take place in prior authorization from being a manual-based process to being a process that is managed through FHIR APIs and automated. And there are actually some early adopters that are doing this already, so we have some statistics from early adopters that kind of paint the picture as to why this is important. So the first statistic you'll see is the number of prior authorizations that can be performed per hour. In the test case, 3 to 5 were done per hour, and then when we moved to automation, 10 to 12 were done per hour. So more than a doubling in the processing of prior authorizations when you move to an electronic API-based workflow. And then also the cost goes down substantially. So we saw a 3x reduction in cost. $8.04 before, $2.25 after. So pretty substantial increase in cost as well. But probably the most important we see in the third line where it impacts patient care. So beforehand, you would see that 94% of the individuals involved or the patients involved would have some type of delay based on prior authorization because it was manual and they had to wait for a response. When you move to electronic, you can see that 89% of the requests resulted in no auth required. Just by making that initial check electronically to see whether auth was required, the response comes back and 89% can then continue on with their care without having to wait at all. All right, so what does this mean? If this is going to be a big impact, how do we make prior authorization electronic? And so we do that by following the DaVinci guidelines and the implementation guides that they publish. And there's 4 of them that are related and work together to solve the prior authorization workflow. And 3 of these, the top 3, are included in the CMS mandate. So there's a CMS mandate, 0057-F, that requires that prior authorization move to be electronic by January 1st, 2027. And these implementation guides are actually referenced in that mandate. So what are they? The first step would be to determine whether prior authorization is even required. So this is the CRD step. It stands for Coverage Requirements Discovery. An API call goes out through CDS hooks that determines whether it's already covered or not, or if prior authorization will be required. You can stop there if you get a yes or no. If it's determined that prior authorization is required, then you'll move to the following steps. And the second step, for the DTR step, which is documentation, templates, and rules, this is the collection of documentation that the payer will need. So this involves a Smart on FHIR app that will be presented at the provider to collect that information. The payer determines what questions are going to be asked for that particular request. They send a questionnaire resource, FHIR terms, back to the provider, and then the provider, through that Smart on FHIR app, exposes those questions. The app pre-populates as much data as possible as it can from the EHR FHIR server. Whatever questions can't be populated, the clinician will then populate the rest. So as a clinician, when they hit the button that says, I want to order this, they should get an immediate response back that says that prior authorization is required. The Smart app launches, and then maybe there's 2, 3 additional questions that they need to answer that couldn't be pre-populated. They can answer those real quick, review the rest, and then move on, and that request goes to step number 3, which is the official request that goes over to the payer. So the clinician's responses to that questionnaire will be saved off as a questionnaire response resource. and then that will be bundled up with other information about the claim and the patient and sent off to the payer. Now, the request that goes over to the payer for the official prior authorization can either be X12-based or it can be FHIR-based. So if the payer can accept FHIR, it'll just go straight through as FHIR. If they still have legacy systems that want X12-278 legacy transactions, it'll be converted to X12 for that particular payer. Then the payer responds back with either approved, denied, or pending. And if it's pending, we can go to step 4, where if they need additional information to make that answer that they haven't received through step 2, they can request additional documentation. That utilizes the DaVinci CDex process, where we'll use FHIR-based technologies to get the data from the provider and then package that up and send it back to the payer, so that then they have all the information they need to then respond back with the final answer. So those are the 4 steps that are defined by DaVinci, that define what is prior authorization and how it will work electronically. Now I'm going to turn it over to Allison, and she'll talk about solutions.
Perfect. So I'm going to go ahead and build this slide out. So what we wanted to represent here is that in order to pass data between providers and payers, there really is a chain link that needs to occur in order to get data from point A to point B. Point A being your providers, point B being any of the applications that are sitting in a payer's ecosystem. So starting over here on the left-hand side, we have our providers. And the intention of these regulations, the intention of these implementation guides, really focuses on provider burden. And a big part of that is keeping providers in their existing workflows today, which is in their EHRs, in their EMRs, in their existing technologies. And being able to create and send these different transactions or questions directly to a payer from something that they're already working in. So that's what we have there on the left-hand side. So our solutions are system agnostic. We have built our solution to the implementation guides to connect to any EHR, EMR, or through an integration partner to be able to support connecting to the different provider technologies. The next step there, the next link in our chain, is going to be where Infor and Cognizant start to work together here. So Infor is supporting that FHIR solution where we're connecting into the EHR. So they are a plugin to an EHR or an EMR that's helping to facilitate these various FHIR transactions. And we're going to go into that a little bit more in the demo today. So everything from the middle there all the way to the left-hand side of the screen, everything that's in blue, right now is something that is supported by Cognizant TriZetto. So TriZetto is one of, we support over 60% of health plans out there with their membership on our core adjudication system, supporting their claims adjudication processes. We also have utilization management applications, and so in the middle there, we also have a TriZetto provider solutions arm. It is the 3rd largest clearinghouse in the nation. We process over 4 billion transactions a year. So this really gives us the opportunity, and we're uniquely positioned to create this entire chain link of data flow from providers to payers, because we're all experienced in this industry and established today. So we have a clearinghouse. We have also FHIR intermediaries, which will be able to route transactions. This is where we get into the many-to-many applications. So the ability to go from many providers, many EHRs, many applications there on the left-hand side to many applications there on the left-hand side where we have our payers. That's your right-hand side, I'm sorry. Everybody knows, okay.
We're tracking with you.
We're tracking, thank you. And then we have our EPA solution. So TriZetto has developed, it's a commercially available solution. We have an EPA solution that supports all CRD, DTR, and PAS transactions. That's been available since August of last year. So I'm gonna show you a demo of that application actually today. And then the last piece there is our payer core system. So this includes, as I mentioned, their claims adjudication, their utilization management systems, anything where they're using to manage quality. And so we are going to connect to those. And I mentioned being system agnostic. We recognize that both payers and providers have unique ecosystems. And that's really where this partnership is really valuable, both for Cognizant and for Infor. The ability to connect these links together, but also be system agnostic, but support optimized integrations with those applications that we know our payers and providers are already using today. So for this next slide, I'm going to go ahead and set us up for a demo. So the first thing that we are going to do, and we're going to go through those transactions that Rob talked about on slide 2. So we are going to go through the CRD process, the coverage requirements and discovery. A reminder, this is there to answer 2 questions, really. Number 1, is the patient eligible? And number 2, is prior authorization required? We're then going to go into the DTR process, where Rob talked about the ability to answer questions or facilitate information gathering based on a payer's requirement. So this is really the opportunity where payers get to be transparent with their providers. What information do I need to render a decision? And I want to give that to you up front. I want to get the answers to those questions, so that way when you send it to me, it's this nice, beautiful package that has everything I need, and I can get you an answer as soon as possible. We're then going to go into the PAS process. So leveraging the Infor Smart on FHIR app, we're going to move from the DTR process into the PAS process, and that's actually going to be submitted directly to one of our prior authorization support APIs, going to one of our utilization management systems in the TriZetto ecosystem. Okay, so I'm going to go ahead and jump into the demo here. Let me see if that's going to pull up for us. Slide it. There we go. Okay. Okay, we're taking a second here. This is going to be fun. So what we are seeing here is the CRD generator, basically a DaVinci open source tool that enables the CRD process. So basically able to test the validity of APIs, but also APIs are just simply not pretty, right? So, and people want to know, what are the providers going to see? How is the information going to be communicated via these APIs? So this gives us the opportunity to see, what is a provider going to see on their side or in their user interface? So this is essentially a mock EMR, very simple mock EMR to kind of show this process. So for the use case that we are going to go through today, we are going to go through a total knee arthroplasty for my patient Raymond. So it does take a little bit of time to set this up, get all of the FHIR profiles built, and so that is how our data is in the CRD generator today. So I'm going to go down here and select my request for a total knee arthroplasty. Okay. So over here on the far left-hand side, we have all of the information for our patient Raymond. So we have his name, we have his general demographics, we have what CPT code we're requesting. This could be really any code set. So as part of the implementation guides, this could be a SNOMED code, this could be a CPT code, this could be a HCPCS code. Our solution supports all of those. And then over here on the right-hand side is going to be everything else that was gathered using prefetch. Prefetch is basically just a way to make that request whole. So who is the provider? What is that practitioner role? What is the service request? So we take all of that information to create the entire request there. So I'm going to go ahead and for our first one, and I think our Wi-Fi is being a little bit slow here. So when I click Submit to CRD and display cards, what we are doing is we're doing a lot of things in the background, and this is mostly an API-based solution, so I'm going to give you a little bit of insight into what we're doing in the background here. The first thing we're going to do is we're going to go through the authorization authentication process. Are you allowed to be accessing my solution? The next thing I'm going to do is, we saw that that code up there is a CPT code. As I mentioned, this could certainly be a SNOMED code. It could be a HCPCS code. And so the next thing that we're going to offer that we have as part of our solution is code translation. So the ability to crosswalk from a clinical code to a billing code, making sure that when we're asking the question, is an authorization required, that this is all speaking the same language, right? Because providers speaking in clinical codes, all of our payer applications, core adjudication, utilization management, everyone is using billing code sets, okay? The next thing that we are going to do is we're actually going to call to a core adjudication system. So this is one of the big things that we feel is really important as a part of this. We actually had Cambia talk about this earlier, which is really the importance of offering a accurate answer or going through a good authorization check. And our approach for this is to actually run a mock claim through the payer's core adjudication system. So instead of asking the question, is an authorization required, I'm kind of flipping that on its head. And I really want to ask the question, in order for the claim to be paid, would an authorization be required? Right? That is already configured in your core adjudication systems. That is something you manage very effectively in order to make sure that your payments are correct and that we're only paying claims that really should be paid. There is no need to duplicate that information. There's no need to manage that multiple places. That really is a source of truth for the authorization downstream process, which is to get a claim paid. And then we're going to orchestrate the responses here. So what you're seeing here are CRD cards. This is one of the ways to display information back to the providers. The other one is system actions. What you're seeing here are cards. These are configurable ways, or in plain English, the ability to actually communicate information to your providers. So this is telling us that a patient is eligible, that prior authorization is required. Again, that is coming directly from one of the core adjudication systems. Again, that about 60% of payers are using today. And then we are telling us that the provider is in network. That's one of that extra pieces of information we get by going through this process, not just using the service code to determine an authorization requirement. And then it's also going to tell us, and this was actually a use case that was built for a client, they had this service delegated out. And so this is an opportunity here to communicate to your providers, hey, by the way, this is a delegated service. If you are interested about their clinical guidelines, if you want to know what's going to come into this process, you can communicate that here. And that link actually goes out to eviCore's guidelines. Okay. I'm going to go ahead and step into the DTR process. So this is where we are going to move into that red portion of the chain link diagram, and when we're going to jump into Infor. So this is going to launch a Smart on FHIR application, the Infor Smart on FHIR application. Been signed out, give me a second. And this is going to move us from the CRD process to the DTR process, and this is the information gathering. So it told us that an authorization was required, but it's also telling me, hey, I need additional information in order for me as a payer to render a decision. This questionnaire could be coming from your medical guideline vendors. It could also be coming from our native tool, where you can digitize your medical policy there. So a couple of different varying sources of truth as to where this clinical guideline or additional information could be configured based on a payer's policy, but is displayed to the providers. So we just have one question here. So I'm going to go ahead and answer that question. And the next thing I'm going to go ahead and do is click Submit. And this is when we're going to move from the DTR process into the PAS process. Remember, the PAS process is really that pretty package that is everything related to the authorization that we've talked to up to this point. It has the answers to this question that I answered, and that actually all goes back to the payer. So the payer was transparent up front with providers. Hey, by the way, this needed an authorization, and oh, by the way, I need additional information. Go ahead and give that to me in the DTR or Infor Smart on FHIR process. And then once you send it to me, ideally, because I was telling you what I needed up front, I should have all of the information I need to either automate that process, or if it's pended, that at least a human has all of the information they need to go through that manual process. So we are taking just a second here to send it to our PAS endpoint. As a reminder, we are going directly to our EPA Solutions PAS FHIR endpoint. This is going into one of our applications. And that is going to return the prior authorization status. So this is going to take us to a window in Infor. Again, this is the Infor Smart on FHIR app, which is really kind of that bridge or one of the links in our chain here. And it's going to show us that all of the authorizations, and I did a few tests, that these are pended for the provider to know directly, right? So as we're sitting here, and it's been probably a few minutes longer than I'm supposed to be talking, to get that information around authorization requirements, fill out the questionnaire, and actually submit the authorization. If the system was to approve that, they would see that here in that process. So based on the process, that would be displayed. So just coming up here to our system, this is where that case was created. So our application within TriZetto is where this case has actually been created. We see we have that authorization ID, we have the request, we also have the place of service, which was the same thing that we saw. We saw the requesting provider. In this case, they're the same as the treating. We also have that same CPT code listed that we had in that CRD process. Okay, so really kind of showing the end-to-end there. I'm going to pass it back over to Janie to talk through what is this partnership going to look like, because we do have a lot of exciting things that we are excited about. Where's my mouse? There we go. A lot of exciting things that we are planning to do with this partnership beyond just prior authorizations.
Thanks to Allison. I think it's helpful to be able to visualize that prior authorization flow. You probably have heard a lot about CRD, DTR, and PAS over the last few days, and it's kind of nice to be able to actually visualize it end to end. So we really appreciate being able to walk through that. One of the things that we think is really cool about these DaVinci implementation guide APIs is that this is a very chatty conversation around prior auth. A lot of us come from that more historical EDI perspective where it's the batch file that's getting dropped off, and so we have our batch 837s, 834s, et cetera. And so what's cool about these FHIR-based transactions is it can be very chatty back and forth between the provider who is with the patient and trying to make the best care decision at that point in time. Being able to make these real-time calls and being able to have this communication bidirectionally taking place in real time is really key to being able to make the best decision. And so we love the fact that in that Smart on FHIR app that Infor has, you're going to be able to have those adaptive questionnaires that are going to be able to, you can answer one question on the provider side, and then the payer may bring back a few more additional questions that need to be answered. But you're getting the exact right information at the right time in order for the decision to be made. And so we think that's really, really exciting about these transactions. The other thing that is exciting is the subscription notifications. So one of the things you can do, so in that scenario that they ran through, if that ended in a pended status, and it may take the payer a few days to be able to make the final decision about that prior authorization request, you are able to have the subscription notifications. So if a provider signs up for notifications with a payer, then they would be able to be proactively notified when that status changed from pended to approved. And so you could find out about that in real time and proactively so that you can get on to being able to deliver the care for the patient. So we're excited about that. Another thing just about this foundational framework that we think is really exciting is once you have this foundational framework in place end to end, it's going to support more than just prior auth, right? We have all of the other DaVinci use cases that we're looking at, and we're really excited about being able to take it to care gaps and looking at DEQM and being able to communicate care gap reporting from the payer to the provider, for the provider to be able to submit data of interest related to the gap closure activity back over to the payer. So you'll be able to do that across this foundation as well. And then looking at other use cases around clinical data exchange, for CDex to be able to exchange other types of documents that are helpful from the provider to the payer as well. So really having that infrastructure in place to support this end-to-end. And one of the things that's important to us from a TriZetto Cognizant perspective as well is to make sure that we are really embracing that spirit of interoperability. We think it's really important that when we design our solutions, we make them agnostic, system agnostic on both sides. So we're not trying to tie to one specific EMR, EHR system. We want to be able to support the providers wherever they are, and we want to be able to help them make that end-to-end connection. Because we know it's important for a provider to be able to connect up with many payers, and it's important for a payer to be able to connect up to their whole provider network. And so that's important regardless of what system everybody's using on both sides. And even on the payer side, we don't want to just connect up to our TriZetto payer solutions. We are happy to be able to route to other endpoints as long as they're aligned with the Da Vinci implementation guide standards as well. Another thing that I just want to point out is that we are really working on this iterative development alongside of M4, and we have a very collaborative environment set up for that, which we'll get into on the next slide. So what now? So what are the action items? Just talk to us. We want to help everybody on their journey, and we know that everybody's coming from a different starting point, right? Some people are just now learning about FHIR and some of these Da Vinci use cases. Some people are well along the way, but we want to engage with you and we want to meet you where you are. So definitely begin the conversation. And then also, if you're wanting to get more involved in testing, we really feel like that's the next best step towards adoption. And so we are happy to be the matchmaker. So if you're a provider and you really want to test, but you just don't know who you can test with, talk to us. We want to facilitate that. Da Vinci wants to facilitate that. So reach out to us if you're a payer and you want to be able to test with providers. We have a lot of connections amongst on the TriZetto side, on the Cognizant side, and also on the Enforce side as well. So we're happy to do the matchmaking and make it happen. So with that, I'll just open it up to any questions.
Yeah?
So I have a question about the 4 steps of the... Hello. My question is about, more specifically, about the 4 steps of the PAS workflow that you guys described. During the demo, you triggered this by going into this, the mock EMR to trigger the CRD request. Can that be somehow automated? Because I'm guessing a lot of that information that you put into that trigger can come from maybe an order message.
Yeah, so the default is a technology called CDS hooks. So when you're in the EHR, all EHRs, hopefully by January 1st, 2027, will have CDS hooks implemented. And there will be an order sign CDS hook. So they would see that order sign, or the system would see that order sign, generate that CDS hooks, and that would trigger the product by default. We do have some early adopters that are looking at going kind of outside the box, because CDS hooks is not available in most EHRs yet, to where we can use legacy order messages or other types of triggers to trigger the whole process. What we do on the Enforce side, we're traditionally a interoperability engine, so we are good at converting data formats. So we can take legacy data formats, convert them to CDS hooks, and then trigger the whole process like it would be normally triggered, but through legacy data. So there's options there as well.
Any other questions?
Okay. Well, yes? One more.
Okay.
So about the questionnaires, you had mentioned that since it's in the patient's context, right? The questionnaire, you said that the system could pre-fill the data as much as it can.
Yep.
Where would that come from?
Yeah, so the questionnaires can be sourced from a couple of different places. I mentioned we have a native FHIR questionnaire engine that allows you to build or digitize your medical policy. This allows you to insert CQL statements, the ability to auto-populate or pull information from an EHR and fill out the questionnaire for them, so there's not data duplication. But the other option is that those could be coming from guideline vendors, things like Interqual, Optum, MCG. We're really excited that we're going to be working with both of those guideline vendors, offering integration so you don't have to duplicate those clinical guidelines. If you have guidelines that you're leveraging from them. We are close to commercializing one, and we're starting an integration with the other to be able to pull those as the source of that questionnaire. So I know that some of them have proprietary languages to auto-populate some of that. Some of them are leaning a little closer into CQL, so there are options to auto-populate that information. Yeah.
Any other questions? Okay, we'll be available afterwards if anyone has any specific ones.
Thank you.